You are 9 months pregnant, and there is no hospital waiting for you. No ambulance, no ultrasound, no sterile room, no epidural, no doctor walking in with a chart. There is only the fire, the dirt under your feet, the people who know your face, and the most dangerous doorway a human body can ever cross. For hundreds of thousands of years, women stepped through that doorway without the tools we now consider essential. And somehow, the human species survived. Not because birth was easy. It was not. Not because ancient women were superhuman. They were not. They survived because pregnancy was never treated as one woman's private problem. The moment someone became pregnant, the whole group had to pay attention. In a small prehistoric band, pregnancy would have changed the rhythm around her long before the birth itself. At first, maybe it was only a quiet suspicion, a missed cycle, a different appetite, morning sickness, tiredness that did not feel normal. Then the body began to show what everyone eventually understood. A new life was growing, and that meant the group had a future to protect. This was not a modern baby announcement with balloons and photographs. It was something more practical, more emotional, and more serious. A pregnant woman was carrying a child, but she was also carrying risk. If she became weak, the baby was at risk. If she died, the group lost not only a mother, but knowledge, labor, kinship, and the child she might have raised. So people adjusted. Not with paperwork or appointments, but with behavior. Older women noticed what she needed. Sisters, mothers, aunts, grandmothers, and close companions brought extra food when they could. Men might share meat more carefully after a hunt. Other women took heavier tasks when the pregnancy became harder. Children were pulled away when she needed rest. Someone watched how she walked. Someone remembered which plants helped nausea, which foods were easier to keep down, which paths were safer when her balance changed. None of this looked like a medical system, but it was one. It was medicine before hospitals, memory, observation, food, hands, and trust. Human pregnancy is strange compared with most animals. Our babies are born helpless, with large heads, demanding brains, and a long childhood ahead of them. Human birth can also be difficult because the baby must pass through a pelvis shaped by the long evolutionary story of walking upright. That does not mean every birth was a disaster, but it does mean birth was never something a group could ignore. A woman in labor needed support. A newborn needed warmth. A recovering mother needed food, protection, and time. Ancient humans did not survive by leaving each mother alone to prove her strength. They survived because other people stood close. The closer the birth came, the more the group prepared. They may not have counted months, the way we do now, but experienced women knew the signs. The lower belly, the tired walk, the swelling, the shifting mood, the baby dropping lower. The long pauses when the mother stopped moving and placed her hands on herself. A place would be chosen. Not necessarily far from camp, but not in the middle of noise and smoke either. Somewhere sheltered. Somewhere with water nearby. Somewhere warm if possible. Somewhere other women could reach quickly. The point was simple. Protect the mother from fear, cold, distraction, and danger. When labor began, the atmosphere changed. The camp did not collapse into panic. This was terrifying, but it was also familiar. Everyone had seen birth before, or at least heard the stories. Children may have been moved away. The fire was fed. Water was warmed. Clean hides or soft plant material were prepared. The experienced women came closer. One may have taken the lead, not because she had a title, but because everyone knew she had seen more births than anyone else. She knew the sounds that meant progress. She knew the difference between pain that was normal and pain that was frightening. She knew when to wait, when to move, when to speak gently, and when to act fast. The laboring woman probably did not lie flat on her back for hours. That position became common much later in medical settings. For most of human history, women likely moved. They squatted. They kneeled. They leaned against another woman. They held a branch, a rope, a stone ledge, or someone's shoulders. Gravity helped. Movement helped. Familiar voices helped. Someone wiped sweat from her face. Someone held her weight when her legs shook. Someone reminded her to breathe. Someone watched the baby's position as best they could, using hands, eyes, and experience. It was not perfect. It was not safe by modern standards. But it was not helpless. And then came the moment everyone feared and waited for. The head. Human babies are difficult because they rotate through the birth canal. The baby does not simply slide straight out like a simple object. The body twists, turns, and finds a path. An experienced birth helper would have watched closely. Too much force could harm the mother. Too much delay could harm the baby. If the birth was normal, the women did what humans had done for countless generations. Support the mother, guide the baby, catch the newborn, and move quickly into the next battle, keeping both alive. The first seconds mattered. A newborn is wet, fragile, and suddenly outside the only world it has ever known. It must breathe. It must stay warm. It must be held. Ancient people may not have understood oxygen infection or body temperature in scientific language, but they understood outcomes. Babies kept against warm skin did better. Babies whose airways were cleared did better. Babies who cried brought relief to everyone listening. The child may have been placed against the mother's chest or held close by another woman if the mother was too exhausted. The cord might be cut with a sharp stone or shell after some time, tied with fiber, and handled carefully because the connection between mother, baby, blood, and life was too obvious to ignore. Then came the placenta. Modern people often forget this part, but experienced birth helpers would not have. The baby was born, but the danger was not over. The placenta had to come out. Bleeding had to be watched. The mother's strength had to be guarded. A calm birth could become deadly if bleeding continued or if something remained inside. This is where ancient knowledge mattered most. Pressure, massage, rest, warmth, certain plants, careful watching, and fast decisions could make the difference between recovery and death. We should not pretend they could solve every emergency. They could not. Obstructed labor, hemorrhage, infection, and malpresentation killed many mothers and babies before modern medicine. But we should also not imagine them as ignorant. Their knowledge was built through repetition, grief, memory, and survival. If the baby lived, the emotional world of the camp changed. A birth was not only a biological event, it was a social one. People came near. They looked at the child's face. They noticed resemblance. They laughed softly at tiny fingers. They worried about feeding. They checked the mother's eyes. They brought food. The newborn was not born into a nursery. It was born into a network of bodies. Warm hands. Shared milk in some cases. Older children watching from a distance. Grandmothers giving instructions. Men waiting outside, relieved and afraid to show too much fear. The child belonged first to the mother, but survival depended on more than one mother. This is one of the deepest truths about human evolution. We are cooperative breeders. A human child takes too long and too much energy for one adult to raise alone. Hunter-gatherer childhood is full of allomothers, which means people other than the mother who help care for the child. Grandmothers, sisters, older siblings, fathers, aunts, and unrelated companions all matter. Pregnancy was only the beginning of a long communal project. After birth, the mother needed rest. She needed calories. She needed water. She needed someone else to hold the baby while she slept. She needed people to protect her from the expectation that she could immediately return to full strength. For days or weeks, her work changed. Maybe longer. Someone brought food to her. Someone helped with older children. Someone kept the fire going. Someone watched the baby while she washed or slept. This was not charity. It was group survival. A baby who lived strengthened the future. A mother who recovered could continue to share knowledge, gather food, raise children, maintain relationships, and keep the group together. In a small band, every life mattered because every life was connected to others. But not every birth ended with joy. Some babies did not breathe. Some mothers bled too much. Some labors lasted too long. Some infants were too early, too weak, or visibly unable to survive. Ancient people knew loss intimately. They did not need written records to understand grief. Archaeological burials of infants and children show that even small lives could be treated with care. A tiny body placed carefully in the ground tells us something powerful. Prehistoric people were not numb to death. They lived closer to it than we do, but closeness did not erase love. This is where the original question becomes more than curiosity. What did ancient humans do when someone got pregnant? They reorganized around vulnerability. They fed her, watched her, taught her, protected her, helped her give birth, helped her recover, helped raise the child. Pregnancy revealed one of the most important survival strategies humans ever developed. We did not become powerful because we were the strongest animal. We became powerful because we learned how to carry each other through moments no one could survive alone. Modern medicine has changed birth in extraordinary ways. It can stop bleeding, treat infection, perform surgery, monitor danger, save premature babies, and rescue mothers who would have died in the past. That matters. The ancient world was not better than the modern hospital when things went wrong. But the ancient world understood something many modern systems sometimes forget. Birth is not only a medical event. It is also emotional, social, and deeply human. Continuous support. Familiar voices, movement, warmth, calm, and trust are not decorations. They are part of how humans have faced birth for most of our existence. So imagine her again. A woman near the edge of a prehistoric camp, tired, sweating, gripping another woman's arms as the fire throws light across the ground. Around her are the people who know her whole life. One holds her weight. One watches the baby. One warms water. One whispers that she can do this. Outside the circle, the night is full of danger. Inside the circle, everyone is focused on one thing. Bring the mother back. Bring the child into the world. Keep the future alive. That is what happened when someone got pregnant before hospitals existed. Not magic. Not perfection. Not safety. A system of care built from bodies, memory, fear, love, and thousands of generations of women learning from the births that came before them. The first delivery room was not a room at all. It was a circle. And at the center of that circle was not just a baby being born, but one of the oldest truths of our species. Humans survive best when they do not face the hardest moments alone.